Anatomy of the abdominal wall, part 2. Functions of the anterior abdominal muscles. They help in flexion of the trunk. They help in contraction of the abdominal wall. They help urination, and so on. The nerve supply of the anterior abdominal wall. These muscles are supplied by the lower 6 thoracic nerves and L1. What do I mean by L1? Lumbar nerve. The L1 divided into 2 nerves, into iliohypogastric and ilioinguinal. I will discuss it. The nerves of the anterior abdominal wall are the anterior rami of the lower 6 thoracic and the first lumbar nerve. They supply the whole thickness of the abdominal wall, from the skin down to the peritoneum. The last nerve, which is the lumbar nerve, the first lumbar, divided into 2. One of them, we call it iliohypogastric, passes between internal oblique and the transversus abdominis muscle, and then pierces the internal oblique 2.5 cm medial to the anterior superior iliac spine, then pierces the aponeurosis of the external oblique about 2.5 cm above superficial inguinal ring. This is the nerve. Can you see it? Can you see it? This is the iliohypogastric nerve. The second one, the second division of L1, we call it ilioinguinal, not iliohypogastric, ilioinguinal, the lower one. Run parallel with iliohypogastric, okay? Run parallel. Enters inguinal canal and exit. Enter the inguinal canal here and exit through the superficial inguinal ring. Supply the skin just above the symphysis pubis and the sacrotum. In female, طبعا, supply another. This is how the nerve supply going and supply the abdominal wall. I want to make it easy for you. The nerve supply of anterior abdominal wall. I want to tell you they are 7 nerves. How many? They are 7. If I say T10 supply the umbilicus, we left with the 3 nerve above and the 3 nerve below. How many nerve supply? They are 7. T10 to the umbilicus. 3 above, of course, 9, 8, and 7. And the 3 below, 11, 12, and L1. L1, I just discussed it. Iliohypogastric and ilioinguinal. Now, this type of question I'm going to ask you in the final year examination. Following an appendicectomy. What do I mean? Removal of appendix by surgery. Your patient complained of having paresthesia or numbness of the skin in the pubic region. The most likely nerve that being injured during the operation is, this is the operation. So what do you think? Which nerve is cut? Is it genitofemoral, iliohypogastric, subcostal, spinal, or ilioinguinal? This is the type of a question we are going to ask in the last year. Now, who remember the layers of the abdominal wall? We start with the skin, subcutaneous tissue, fascia, and the 3 layers of muscles. Now we are reaching to the 6th layer, which is the fascia transversalis. This thin layer of fascia that line the transversus abdominis muscle. The seventh layer is the peritone. But which peritone? Parietal peritoneum. Parietal peritoneum. Because we have two layers of peritone, visceral and parietal. This is the parietal, which is lining the walls, S here, it means all of them, of the abdomen are lined with parietal peritoneum. This is a thin serous membranous and continuous below with the parietal peritoneum lining the pelvis. What are the arteries of the anterior abdominal wall? They are superior epigastric artery, inferior epigastric artery, deep circumflex iliac artery, lower two posterior intercostal and lumbar arteries. So, very rich blood supply of the anterior abdominal wall. This is a picture showing you the superior epigastric vessels, inferior epigastric vessels, lumbar vessels here, subcostal, intercostal, and subcostal here, and so on. From the internal thoracic or internal mammary, we have the superior epigastric. This is one. Two, from the descending aorta, we have intercostal, subcostal, and the lumbar. And three, from the external iliac artery, we have deep circumflex and inferior epigastric. So repeat it again. First, from internal thoracic, what we have? Superior epigastric. Two, from the aorta, what we have? Subcostal, intercostal, and the lumbar. Three, from the external iliac artery, what we have? Deep circumflex and inferior epigastric artery. All these arteries making very rich blood supply of the abdominal wall. This is another picture showing you the nerves, showing you the arteries, and so on. Superior, inferior epigastric, deep external, you can read it. Where are we in this picture? We are inside the abdominal cavity, looking for the anterior abdominal wall from where? From posterior. Just to remind you, these are the inferior epigastric vessels. This is a transverse section showing you the aorta with these branches. In the thorax, they are intercostal. In the abdomen, they are lumbar arteries. Right? Here written, intercostal. We are in the thoracic region. The veins of the anterior abdominal wall, they are two types. Superficial veins, of course, and deep veins. Above the umbilicus and below the umbilicus, they are divided. The deep veins of the abdominal wall, they are, can you read them? The same names of the arteries. They are accompanied to the arteries. The lymphatic drainage of the abdominal wall, superficial lymph vessels, also divided above the level of umbilicus and below the umbilicus. Above umbilicus, the lymphatic drainage going to the axillary region. Below umbilicus, the lymphatic system going to the inguinal region. The deep lymph vessels follow the arteries and going to the internal thoracic, external iliac group, posterior mediastinal, and para-aortic.